Hi, welcome to the Nonpublic School Health Services webinar. My name is Jessany Gordon, and I'm the Director of Nonpublic School Services for the New Jersey Department of Education. This presentation was developed for both districts and nonpublic schools to understand the process for delivering health services to nonpublic schools and the legal requirements around consultation and documentation. Recently revised guidelines provide more detail and should be read carefully. You're also welcome to send us your questions by email. Before we get into the nonpublic school health services, I'd like to briefly mention that we have recorded webinars and guidelines for the nonpublic school programs managed at the department, which include auxiliary and remedial services, also known as chapters 192 and 193, the Nonpublic School Security Program, the Nonpublic School Technology Initiative, the Nonpublic School Textbook Program, and Nonpublic School Transportation. Digging into the Health Services Program, districts must provide to nonpublic schools basic nursing services, which include assistance with medical exams and dental screening, screening of hearing, maintenance of student health records, and notification of county health officials of students who have not been immunized, and emergency care for students who are injured or become ill at school or during participation on a school team or squad. Non-public schools may decline the basic nursing services and request additional medical services, supplies, and equipment. There's no requirement that non-public schools must receive basic nursing services in order to receive additional medical services, supplies, and equipment such as EpiPens and defibrillators. Non-public schools may choose to fund their own nurse and request that the state funds be used to purchase supplies and equipment. The supplies and equipment should be comparable to those used in the district in terms of the type and cost. The district and non-public school will agree on the services, supplies, and equipment at the consultation. Statute 18A:40-27(1), passed in 2014, permits state-funded non-public school nurses to treat pre-K students in emergency situations. This applies only to pre-K students attending a non-public school that's eligible for non-public funding. The annual process for providing health services to non-public schools begins in early spring. In March, the district must decide if it will provide services directly or if it will be using a third-party provider. The district also should determine in the early spring if it will be considering a new health services provider. Legislation requires the district to consult with the non-public school before changing the service provider. Therefore, if a district is considering a new health services provider, it must consult with the non-public school to learn about their level of satisfaction with the current nurse, including input from parents and what factors are important in selecting a new provider. For example, does a school want to maximize the number of nursing hours that it will receive? Or does a school want to keep the same nurse, even if the hourly rate is higher? Because of the importance of the nursing function in the school, the non-public administrator would like to be involved as much as possible in the selection process. We strongly recommend that the consultation to discuss a new provider take place in the early spring so that the district has enough time to complete the contracting process prior to the start of the school year. The regulations require districts to make every attempt to provide nursing services at the start of the school year. Having a nurse in place once students are in the building is critical, so we recommend that the consultation for a new provider take place in March, and in April the contracting process should be initiated. If there's no change for the upcoming year, then the consultation should occur in May. I'd now like to talk in more detail about the consultation process, which is a critical element of all non-public school programs. The district is required to engage in timely and meaningful consultation with each non-public school on an annual basis to inform the school of the amount of funds allocated to it, to agree on the health services to be provided and any supplies or equipment that may be purchased, to ascertain the school's satisfaction with the current nursing program, and to ensure students who are knowingly without medical coverage have access to the NJ Family Care Program and have information on the program. As I just explained, consultation is also required to discuss any tensions the district may have in changing its provider. The statute says, quote, prior to any change in the provision of these services, the board shall provide timely and meaningful consultation with appropriate non-public school representatives, including parents, end quote. If a change in a provider is contemplated, the following topics should be discussed. First, the non-public school and its parents' level of satisfaction with the current provider and any concerns about the delivery and quality of services. Number 2, the board's reasons why it wants to change the provider. Number 3, the listing of providers being considered and their suitability for the student's needs. And 4, the criteria to be used in the selection of a new provider. The district should consider the needs and requests of the non-public school, including their requesting the nurse who will provide the services. As I discussed on the last slide, timely consultation means that it should occur before changing providers or making changes in the services offered, and in time to begin services at the start of the school year. We've developed a consultation form that will serve to guide the district and the non-public school through the consultation process. This form can be found on the Non-Public School Services website. The items that must be discussed at the consultation are the amount of funds allocated to the non-public school, the health services to be provided, any additional services, equipment, or supplies to be provided, the start date for nursing services, how the nursing position will be filled in the event of a long-term absence or leave, and the criteria to be used in the contracting process, if applicable. Both the non-public school administrator and the district chief school administrator or their designees must sign the agreement. Now I'd like to talk about reporting and documentation requirements, which serve an important purpose for the districts and non-public schools. In a nutshell, these requirements help provide transparency on costs. They serve to monitor the provider, and they meet the department's record-keeping and auditing requirements. By October 1st, a number of documents must be provided to the Executive County Superintendent, with a copy provided to the non-public school administrator. The reporting documents are, number 1, the Nursing Consultation Agreement Form, 2, a copy of the contract with the service provider, if applicable, 3, the Distribution of Funds Form, which I'll discuss in more detail shortly, and a description of the type and number of services that were provided during the previous school year on a form called the Annual Non-Public School Nursing Report Form. All of these reporting forms can be found on the Non-Public School Services website. I already discussed the consultation form. The copy of the contract with the service provider and the distribution of funds form are important because they provide information on the cost structure, which allows an analysis of the efficiency of spending. The last form listed here, the Annual Non-Public School Nursing Report Form, is required for record keeping. Now I'd like to focus on the distribution of funds form. This form was developed to increase the transparency of how the health service funds are being spent. It allows the districts and the non-public schools to dig into the efficiency of spending, including the amount of funding spent on administration and oversight versus the number of service hours. The specific information to be provided include the following: the total amount of funds allocated to the non-public school for nursing services, total nursing service hours, including a breakdown of the number of annual nursing service hours and the hourly rate, equipment or supplies costs, and the district's administrative costs, which are not to exceed 6% of the total allocation. In nearly all cases, non-public schools want to maximize the number of nursing hours they get. We're asking districts to focus on the number of nursing hours from a provider and try to identify providers that are able to maximize their nursing hours. We've developed nursing program guidelines available on the non-public school website, which include the relevant statute and code. In addition, we've posted on our website a number of helpful resources, including a sample service provider proposal evaluation rubric developed by a district Business Administration, and fact sheets and guidelines for specific health requirements. Please check out our website and the information on the Non-Public School Nursing Services Program. Visit www.state.nj.us/education/nonpublic/. If you have any questions, please email us at nonpublicschoolservices@doe.state.nj.us or call Greg Coker at 609-633-0251. This concludes the presentation. Thanks for listening.